Welcome to the Cheer Athlete. This week, we're going to talk about body positions and what flyers need to know for body positions. And here's a hint, it also applies to bases and tumblers and back spots and dancers and anything here in between. Let's get on with this. Welcome to the Cheer Athlete podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. So it's a common question I see on the cheer mom groups about how do I improve my body positions for my flyers. This episode is not actually going to talk about straight up body positions like heel stretches and arabesques and scorpions, scales, and needles, bow and arrows. That is under the coaching guidelines. The coaches will help you with that. And people who are currently cheering. I can tell you a heel stretch pulls up straight in front of you. You got to grab your heel. I can tell you that an arabesque, the leg kicks out behind you, and you got to have your legs straight, and you're going to turn and face to the side with your arms out in a T. I'm a little bit old school, and those were the levels that we were at when I was coaching. If you've listened to me in other episodes, I am not a fan of the needle. Only young kids can get them. Maybe not true, but generally they lose it as they start to get into teen years because their body grows too fast and they just can't keep that same flexibility. I don't like them because they put strain on the back. So that's my 2 cents on a needle. But beyond that, go to your coaches to find the skill level and to find positions for that. So what can I help you with? Let's talk about what it takes to get to that level that you're going to be working on a heel stretch or an arabesque or beyond. So we start with two-legged stunts, right? An extension, a prep, maybe even thigh stands, which I think those are a great place to start because they are lower to the ground. The kids can start to control them, and you have to actually have body position awareness, both bases and flyers, to maintain that. The key thing that I think is important as far as reducing injuries and not pulling a hamstring or creating strain on your lower back and being able to progress your skills so that you can have better stunts down the road is learning body awareness and body positioning just on the ground. Very often we tell our kids to stand up straight. And when I do this in the clinic, I'm like, okay, sit up tall. And automatically they go like this. So if you're listening and not watching, they lift their sternum and the rib cage up, they arch their lower back, and they are trying to get as tall as they can. The problem here is as you arch your back and your ribs go forward, like your body's supposed to move that way. And we need to train it to go through that way. But it sets your center mass off, puts your belly button way forward. And then, if you're up in the air, that's going to make the bases have to travel forward. If you're a base and you're doing this, it puts a whole lot of compression through your lower back. So in every exercise, sternum down, ribs level. Pretend like the bottom, you can't see it, I know. Pretend like the bottom of your ribs are resting on a table, and they're going to rest flat on that table. The same on your pelvis. Pretend your pelvis is a bowl. If you tip the bowl forward, all the water falls out. If you tip the bowl back too far, all the water goes up that way. We want to find that somewhere in between. So the pelvis, the bottom of the pelvis, those sit bones, that can sit flat on a table and the bowl can be filled. There's a lot of holes in the pelvis, so probably not going to happen filled with water, but you get the idea. So we want that pelvis and the ribs to be even over each other. We want them to be stacked right on top of each other, and what I like to call centered. They stack. So the ribs, if you're looking from the side, if the ribs go this way and the butt goes that way and the pelvis goes into an anterior tilt, this is a posterior tilt to the ribs. So again, if you're listening, I'm just showing with my hands. Go check out the YouTube video. You'll see what I'm explaining. But the ribs go back and up, and the pelvis goes forward, and the butt goes out. That's an anterior tilt of the pelvis and then posterior tilt of the rib cage. Don't have to really remember that. But we want them to be stacked right over each other so that they're level. And that automatically causes your abdominals to be in a great centered aligned position so you can get the most contraction and the most stability out of that. So on the ground, work on lifting the rib cage, lifting the sternum, and sticking the booty out, and then bringing the rib cage down, tucking the bottom under, and getting it short as you can. Making it easier, let it have a string from the top of your head, pull you up to the ceiling, and then compress you down. It's like a magnet is pulling you up and a weight is pushing you down. Go back and forth between these two positions, and then finally come and center in the middle where you feel that you're not really up tall and you're not really slouched. If you're a base or you're a parent and you're trying this, you should notice that your back actually hurts less. If you're a flyer, when they learn how to do that in a two-legged position, they will create that stability and create a centered position that their center mass falls directly between their feet and directly between the base's hands, which is exactly where we need that to be so that we're not traveling forward or back. When we transition into a single leg stunt, like a lib, we want same thing. We want that pelvis relatively level. If one hip is hiked up higher, it's going to cause a shoulder to drop down. It actually shoots the opposite hip out to the side, and the bases have to hold, and they're trying to control the flyer from going all the way out. So we want that rib stack or the pelvis stacked from side to side also. I like to think of the movie Willy Wonka and the Chocolate Factory, the old one, Willy Wonka, where Veruca Salt, I like Veruca Salt because I want an Oompa Loompa now, Daddy. And she finally gets her due course and she falls into the chute and it shoots her up and out into wherever they go. I don't think we ever find out where they go. It's kind of weird. If you haven't watched it and you're younger, go watch it. If your kids are too young, make sure you supervise them and don't let them get scared. But that's what we want them to be. We want them to be in that tube, that everything is narrow, tight. There's no room for going side to side. And the hips and the ribs from the side to side motion have to stay in that tube also. It can't be dumping out of that side. They got to be pulled right up and in. So we're thinking magnet, but ribs down, pelvis level, and pulling right into center that we're not having any side to side wobble and we're not having any forward and back wobble. I don't tend to see a lot of rotational, but if one hip is more forward, so they pull that lib and that knee kind of goes forward, it's driving the pelvis forward at the same time, or back if it's too far back, right? And so that's going to create more of a twisting effect. So again, we want to pretend like we're in that chute, that we're not able to twist, and it's a really narrow container. When we can do this, when we get that rib cage centered over our pelvis and the pelvis stays level, both on double leg and single leg, the rest of it's all going to fall in place. It also comes in with the head, right? We don't want the head to be chin to be pushing way forward. And you also don't want to be standing so you're making a huge double chin. You want to be able to pretend like you have an apple between your chin and your chest and that your ears are stacked over your rib cage. That'll help keep everything all in line. And that centered position creates more stability through our body. It creates less tension in our body so that we can actually create better strength and tension to be able to hold. It keeps us centered. As a flyer, it takes the strain off the bases because you're holding in the middle. If you're a base, it takes some strain off your back by keeping the ribs and your abs engaged, and you work your legs a little bit more. And then you can keep your shoulders out of your ears so that you're not developing neck tightness at the same time. Same thing goes for a back spot. Actually, if they're coming in, they're really having to lean back. Pulling those ribs down and stepping in will take some strain off the lower back. It's important if you're a new flyer or an experienced flyer, like learn these positions on the ground. Do them in sitting first, then try them in standing on two legs, then try it on one leg. It's a lot harder standing on one leg to control that balance and to get that positioning. So gotta nail it on the floor. And if you want to use your stunt stands, go for it on the stunt stand. Or if you don't have a stunt stand, go on a step or a step stool and just step up and pull and make sure that as you're pulling up, you're not lifting the sternum, but we're keeping that all level. If you have a Bosu, that works great because that throws a little balance in that too, and it puts a little extra challenge on that. The ankle gets involved. We want that hip over the knee, over the ankle, and the pelvis level. In a lot of ways in my clinic, I think everything is driven from the foot. But in cheer and for flyers, yes, you do have to have that foot control. But if you control where your pelvis is, the pelvis actually mimics the foot in gait patterns. So if you control where your pelvis is and you work on that being level and stable, it's going to create more stability in the ankle. And you're not going to have to work as hard. Always thinking that knee is straight, extended, that the knee is not kind of caving in when we're loading at the same time. Again, that can drive from the hips and the pelvis. And if we can keep those and the core stable and allow our legs to and our arms to move, everything is going to look more beautiful up in the air. And you're going to progress. You're going to have less risk of injury. You're going to have better flexibility in the air. And you might not go as far. It's going to look better because you're going to have control and pulling up and just getting it to where you can. And gradually over time, that's going to get easier and higher because you're controlling the strength and mobility. Do exercises, practice your body positions on both sides, because you'll be a better flyer when you can do something on both sides. And that will help to create that control for you in the air as well, and less risk of just developing overuse and over flexibility on one side versus the other. When you do that, that's going to carry over into your jumps. So ribs down, pelvis level, chin slightly tucked, and pulling into the middle so that everything is centered and level. It's not, once you get the hang of it, it gets easy, but it's not that easy starting it. And, if you're struggling with it, send me a message and we can talk it through a little bit. There's ways to regress from sitting, doing it lying down, or sitting on a ball. Some kids just haven't found that position and been able to do that yet. So it takes a little bit of neural control and kind of reprogramming how their body moves to find that. But once they find that, it's clear sailing. That's how I cue people. It's how I cue all my patients and all my clients when they start to weight train and strength train. They want to try and keep that container still so that you maintain the most strength. When you're out of that, we don't need to walk around and just holding there. We need to allow things to move. But using this as an exercise to find that center will actually strengthen the core a lot. I hope that's helpful. If you have any questions, please don't hesitate to ask. And if you have questions about any topic that I can help with as far as reducing injuries or building strength, what body positions should look like as far as mechanics, biomechanics go, check out the Ask a PT form. There's no commitment to it, and I'll answer your questions here. And if it's something I can do an extra video on, I'll do that. I will try to do an extra video on this as well, and put that up on YouTube. So stay tuned for that. It's a little chaotic right now, so it might not happen this week, but it's in my head to do. If you want more information on injury prevention techniques, you can check out the Injury Prevention Starter Kit, which is linked below. I hope you have a great week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. And as my dear friend Drew Keller has said, you're responsible for your own vibes. Go get the day.